Next part of the temporal bone is the tympanic plate. It is a curved plate of bone situated below the squamous part of the temporal bone and in front of the mastoid part. It is having two surfaces, anterior surface which is concave and it is related to the part of the parotid gland, and posterior surface not visible here. This is posterior surface. It is also concave and it forms the wall of the external acoustic meatus. My probe, it is in the external acoustic meatus. So the anterior wall, then floor and part of the posterior wall is formed by the posterior surface of the tympanic plate, and it is having three borders. This is superior border, this is inferior border and this is lateral border. The superior border, it meets with the squamous part at the squamotympanic fissure, and this border, it forms the posterior edge of the petrotympanic fissure. And the lateral border, this one, it is a carved ridge to form the lateral opening of this external acoustic meatus. Here the cartilaginous part of the external auditory meatus is attached. The total length of this meatus in adult is about 24 mm, of which the lateral cartilaginous part, which is not here, it is about 8 mm, and the medial bony part, it is about 16 mm. So total 24 mm. And this meatus in the child and in the adult are different, because in a child the meatus is shorter in length due to the non-development of the bony part of this meatus. So in the newborn, it is represented by a tympanic ring. Then come to the inferior border. This border, it is thin and sharp. So it encroaches on the inferior surface of the petrous part of the temporal bone, and here it splits to enclose the styloid process. You see this bone, this inferior border, it splits here to enclose the proximal part of the styloid process, and the proximal part of styloid process is called the tympanohyal part. So the styloid process having two parts. One is proximal part, which is ensheathed by the splitting of the inferior border of the tympanic plate, and the distal part is called the stylohyal part. The two parts, they fused, and all the attachment of the styloid process, it is only in the stylohyal part, not in the tympanohyal part, and total length of the styloid process is about 2.5 cm. Then what are the muscles and ligaments attached to the styloid process? There are three muscles attached to the styloid process, and the three muscles are styloglossus muscle from the anterior surface, and stylohyoid muscle from the posterior surface, and stylopharyngeus muscle from the medial surface. And all these three muscles are supplied by different nerve, like styloglossus by the hypoglossal nerve, stylohyoid by the facial nerve, and stylopharyngeus by the glossopharyngeal nerve. And two ligaments are attached to the styloid process. One is stylohyoid ligament extending from the styloid process to the lesser corner of the hyoid bone, and another one is the stylomandibular ligament extending from the tip to the angle of the mandible. The styloid process, it is related or overlapped by the parotid gland, through which one nerve and one artery enters into the parotid gland. One is the facial nerve and the artery is the external carotid artery. Medially on this side, the styloid process is related to the internal jugular vein behind, internal carotid artery is front, and in between these two, the cranial nerves, last four cranial nerves like 9, 10, 11 and 12 intervening between the internal carotid artery and the internal jugular vein. And the styloid process, it is developed from the cartilage of the second branchial arch. And sometimes one interesting question is asked, what is styloid apparatus? The components of styloid apparatus are the styloid process itself and the three muscles and two ligaments attached to the process, lesser cornu of the hyoid bone. All these components are the parts of styloid apparatus. And the proximal tympanohyal part, it ossifies before birth, and the distal stylohyal part, it ossifies after birth. After that, the two parts fused. And in between the styloid process and mastoid process, there is a foramen. This foramen is called stylomastoid foramen. And through this foramen, two important structures are passing. The structures are the facial nerve, which is coming out from the intracranial side to the extracranial side in this way, and the stylomastoid branch of posterior auricular artery. Next we will discuss the petrous part.